CNA Practice Test Answers. Question 1. The nurse is working in the emergency room when a client arrives with severe burns of the left arm, hands, face, and neck. Which action should receive priority? Option A, starting M4. Option B, applying oxygen. Option C, obtaining blood gases. Option D, medicating the patient for pain. The correct answer is option B, applying oxygen. Burns to the face and neck compromise the airway due to potential inhalation injury and edema. Applying oxygen is the priority. For access and pain, medication follow after airway is secured. Question 2. When taking a resident's blood pressure, the nurse aide hears the first sound at 130 mm Hg and the last sound at 80 mm Hg. How should this be recorded? Option A, 130/80. Option B, 80/130. Option C, 130/50. Option D, 80/50. The correct answer is option A, 130/80. Blood pressure is recorded as systolic over diastolic. The first sound heard, Korokov phase I, is systolic pressure. The last sound heard, Korokov phase V, is diastolic pressure. 130/80 mm Hg is within normal range for many adults. Question 3. An immobile elderly male has wet-sounding lungs, concentrated urine, and temperature 95.8 degrees Fahrenheit, 35.4 degrees Celsius. What nursing action is most important? Option A, turn the client every 2 hours. Option B, increase fluids. Option C, administer diuretics. Option D, encourage coughing. The correct answer is option A, turn the client every 2 hours. Wet-sounding lungs suggest fluid accumulation or pneumonia. Hypothermia, 95.8 degrees Fahrenheit, and concentrated urine indicate possible infection or metabolic issue. Turning the client every 2 hours mobilizes secretions, improves ventilation, and prevents further respiratory compromise. Question 4. A resident is on oxygen therapy via nasal cannula. The nurse aide notices that the tubing has become disconnected. What should the aide do first? Option A, reconnect the tubing and check the flow rate. Option B, turn off the oxygen completely. Option C, remove the cannula from the resident's face. Option D, call the nurse to fix the problem. The correct answer is option A, reconnect the tubing and check the flow rate. Oxygen is a prescribed medication. The aide should immediately reconnect the tubing and verify the flow rate is at the prescribed level. Delaying action could cause hypoxia. The aide should then report the incident to the nurse. Question 5. A client with cancer is admitted with lab values HgB 12.6, WBC 6500, K plus 1.9, uric acid 7.0, Na plus 136, platelets 178,000. The nurse evaluates that the client is experiencing which condition? Option A, hyponatremia. Option B, hypokalemia. Option C, myelosuppression. Option D, leukocytosis. The correct answer is option B, hypokalemia. Normal potassium is 3.5-5.0 mg/L. A potassium level of 1.9 mg/L indicates severe hypokalemia, which can cause cardiac arrhythmias, muscle weakness, and paralysis. Other values are within normal limits. Question 6. Which intervention should the practical nurse implement to reduce the incidence of urinary tract infections in a client with an indwelling catheter? Option A, irrigate the catheter with sterile distilled water daily. Option B, dilute an antiseptic solution in the perineal wash. Option C, cleanse the perineal area with soap and water twice daily and PRN. Option D, apply an antibiotic ointment around the urinary meatus twice daily. The correct answer is option C, cleanse the perineal area with soap and water twice daily and PRN. Routine perineal cleansing with soap and water, twice daily and after bowel movements, reduces bacterial migration along the catheter. Routine irrigation and topical antibiotics are not recommended and may promote resistance. Question 7. A 24-year-old female client is scheduled for surgery in the morning. Which is the primary responsibility of the nurse? Option A, taking the vital signs. Option B, obtaining the permit. Option C, explaining the procedure. Option D, checking the lab work. The correct answer is option A, taking the vital signs. The nurse's primary responsibility is taking preoperative vital signs to establish a baseline and identify abnormalities that may require surgery postponement. Obtaining the permit and explaining the procedure are the physician's responsibility. Question 8. What is the normal range for an adult's resting pulse rate? Option A, 40 to 60 beats per minute. Option B, 60 to 100 beats per minute. Option C, 100 to 120 beats per minute. Option D, 120 to 140 beats per minute. The correct answer is option B, 60 to 100 beats per minute. Normal adult resting pulse is 60 to 100 beats per minute. Bradycardia is below 60, tachycardia is above 100. Both should be reported to the nurse, especially if accompanied by other symptoms. Question 9. A resident has an indwelling urinary catheter. When providing perineal care, the nurse aide should: Option A, clean away from the meatus, down the catheter tubing. Option B, clean toward the meatus, from tubing toward the urethra. Option C, leave the catheter alone since it is sterile. Option D, apply powder around the insertion site. The correct answer is option A, clean away from the meatus, down the catheter tubing. Perineal care for a catheterized resident involves cleaning away from the meatus, down the catheter tubing, to prevent introducing bacteria into the urethra. The catheter should be held at the insertion point during cleaning to prevent tension. Question 10. When providing a bed bath, the nurse aide should wash the resident's body in which order? Option A, face, chest, arms, legs, back, perineum. Option B, perineum, legs, back, arms, chest, face. Option C, back, perineum, legs, arms, chest, face. Option D, any order is acceptable as long as all areas are cleaned. The correct answer is option A, face, chest, arms, legs, back, perineum. The recommended order is cleanest to dirtiest, face, then neck and chest, arms, abdomen, legs, back, and perineum last. This prevents spreading bacteria from soiled areas to clean areas. Question 11. The nurse aide is caring for a resident who is receiving enteral nutrition, tube feeding. The aide notices the tube feeding has stopped flowing. What should the aide check first? Option A, if the resident has had a bowel movement. Option B, if the tubing is kinked or clamped. Option C, the resident's blood glucose level. Option D, the expiration date of the formula. The correct answer is option B, if the tubing is kinked or clamped. The most common cause of tube feeding flow interruption is a kinked tube or inadvertently clamped tubing. The aide should inspect the tubing from the bag to the resident before troubleshooting other causes. Question 12. A client with cancer who has taken opioid analgesics for 2 years requires increased doses for pain relief. The client fears addiction. What information should the nurse provide? Option A, opioid use with cancer does not cause addiction. Option B, the addiction is easily reversed if it occurs during pain management. Option C, prescribed opiates for cancer pain relief improve quality of life. Option D, opiate dosages can be tapered if a client fears addiction. The correct answer is option C, prescribed opiates for cancer pain relief improve quality of life. For cancer patients, opioid therapy focuses on pain management and quality of life. Tolerance, needing higher doses, is not addiction. Addiction is a psychological dependence characterized by loss of control and compulsive use, which is rare in cancer pain management. Question 13. A client is admitted with Ewing's sarcoma. Which symptoms would be expected due to this tummus location? Option A, hemiplegia. Option B, aphasia. Option C, nausea. Option D, bone pain. The correct answer is option D, bone pain. Sarcoma is a type of bone cancer, therefore, bone pain is the expected presenting symptom. Ewing's sarcoma most commonly affects the long bones of the arms and legs, pelvis, or chest wall. Question 14. When providing foot care to a resident with diabetes, the nurse aide should not: Option A, dry thoroughly between the toes. Option B, report any redness or open sores. Option C, soak the feet in warm water. Option D, apply lotion to dry areas, avoiding between toes. The correct answer is option C, soak the feet in warm water. Diabetic residents should not soak their feet because soaking can dry out skin, increase infection risk, and lead to skin breakdown. Feet should be washed gently with mild soap and warm water, then dried thoroughly. Question 15. Which action should the practical nurse take when drawing medication from an ampoule? Option A, aspirate with a filter needle and syringe. Option B, tap the bottom of the ampoule lightly. Option C, snap the neck of the ampoule toward the nurse. Option D, use an alcohol swab to open the ampoule. The correct answer is option A, aspirate with a filter needle and syringe. A filter needle must be used to withdraw medication from an ampoule to prevent glass particles from being drawn into the syringe. The needle is then replaced before injection. Ampoules are snapped away from the body. Question 16. A resident who is usually alert and oriented suddenly becomes confused and agitated. The nurse aide should first. Option A, apply soft wrist restraints to prevent injury. Option B, report the change in condition to the charge nurse immediately. Option C, turn off the lights and leave the resident to rest. Option D, administer an as-needed sedative from the medication cart. The correct answer is option B, report the change in condition to the charge nurse immediately. Sudden change in mental status can indicate a serious medical condition, UTI, stroke, hypoglycemia, infection. The nurse aide must report this immediately to the nurse for assessment. Restraints and medications require orders. Question 17. An older adult client admitted with dehydration and electrolyte imbalance is confused and incontinent of urine. Which strategy provides the best intervention for incontinence? Option A, insert an indwelling urinary catheter. Option B, apply absorbent incontinence pads. Option C, restrict fluids after the evening meal. Option D, establish a 2-hour voiding schedule. The correct answer is option D, establish a 2-hour voiding schedule. A scheduled voiding program, every 2 hours, promotes continence by establishing a routine and minimizing accidents. Catheters increase infection risk. Fluid restriction is inappropriate for a dehydrated client. Question 18. The nurse aide is providing post-mortem care. Which action is most important? Option A, removing all tubes and lines. Option B, placing the body in a supine position with arms at the sides. Option C, ensuring proper identification of the body. Option D, bathing and dressing the body. The correct answer is option C, ensuring proper identification of the body. Proper identification of the body is the most important step to prevent misidentification. Identification tags should be applied before any other care. Other steps, bathing, positioning, removing equipment, follow but are secondary to identification. Question 19. The nurse is visiting a home health client with osteoporosis who has a new prescription for alendronate, Fosamax. Which instruction should be given? Option A, rest in bed after taking the medication for at least 30 minutes. Option B, avoid rapid movements after taking the medication. Option C, take the medication with water only. Option D, allow at least 1 hour between taking the medication and taking other medications. The correct answer is option C, take the medication with water only. Fosamax must be taken with a full glass of plain water only, not juice, coffee, or other beverages, to ensure absorption and reduce esophageal irritation. The client must remain upright for 30 minutes after taking it. Question 20. A young woman, primary caregiver for her mother with Alzheimer's disease, says, "Sometimes I hate my mother for living this long." What response should the nurse offer? Option A, what do you do to cope with these feelings? Option B, have you told your family how you feel? Option C, it's normal to feel these emotions when you are stressed. Option D, don't worry, at least you can talk about being angry. The correct answer is option A, what do you do to cope with these feelings? The most therapeutic response assesses the client's coping strategies. Asking what do you do to cope opens dialogue, validates the feeling, and identifies healthy or maladaptive coping mechanisms. Question 21. The nurse is preparing to administer a transdermal patch. Before applying the new patch, the nurse should: Option A, apply the new patch next to the old one. Option B, remove the old patch and clean the site. Option C, apply the new patch directly over the old patch. Option D, cut the patch in half for a smaller dose. The correct answer is option B, remove the old patch and clean the site. The old patch must be removed and the site cleaned before applying a new patch to prevent toxicity from accumulated medication. Sites should be rotated to prevent skin breakdown. Question 22. A resident with COPD is receiving oxygen at 2L/min via nasal cannula. The family asks why the flow rate is so low. The nurse aide should explain. Option A, the doctor is being cautious to prevent oxygen toxicity. Option B, high oxygen can actually stop some COPD patients from breathing. Option C, the resident prefers low flow because it's more comfortable. Option D, the facility limits oxygen to save money. The correct answer is option B. High oxygen can actually stop some COPD patients from breathing. Some COPD patients rely on a hypoxic drive, low oxygen level, to stimulate breathing. High oxygen flow can remove this drive, causing respiratory depression or arrest. This is a critical safety concept. Question 23. A client has rectal cancer and is scheduled for an abdominoperineal resection. What should be the priority nursing care during the postoperative period? Option A, teaching how to irrigate the ileostomy. Option B, stopping electrolyte loss in the incisional area. Option C, encouraging a high-fiber diet. Option D, facilitating perineal wound drainage. The correct answer is option D, facilitating perineal wound drainage. The perineal incision will have drains to facilitate wound drainage and prevent infection. Promoting drainage is the priority. The client will have a colostomy, not ileostomy. Question 24. A resident has an order for a mechanical soft diet. Which food is appropriate to serve? Option A whole apple. Option B, scrambled eggs. Option C, a hard roll. Option D, whole kernel corn. The correct answer is option B, scrambled eggs. Mechanical soft diets include foods that are easy to chew and swallow, such as scrambled eggs, mashed potatoes, ground meat, and cooked cereals. Whole apples, hard rolls, and whole kernel corn require significant chewing. Question 25. A 6-month-old client is admitted with possible intussusception. Which question during the nursing history is least helpful? Option A, tell me about his pain. Option B, what does his vomit look like? Option C, describe his usual diet. Option D, have you noticed changes in his abdominal size? The correct answer is option C, describe his usual diet. Usual diet is not directly relevant to diagnosing intussusception, telescoping of the bowel, pain description, vomit characteristics, bilious is concerning, and abdominal changes are all directly relevant.